Quality and affordable healthcare go hand in hand. They don't have to be separate.
It's an exciting time to be part of this sort of movement. It's finally a time where people are recognizing that this is the way to do healthcare.
This is why I keep coming back here.
Never a boring day. You have a 2-year-old who has all kids Medicaid. You have a new Syrian refugee who has no insurance but who needs healthcare. You have an adjunct Northwestern professor who lost his insurance.
Erie never says no.
The mission for Erie has remained the same. We believe healthcare is a right, not a privilege.
I feel like an important person. I do not feel like they're just trying to get me in and get me out.
To see people who have faced so many barriers and so many challenges, and when they come to Erie, to see not only their health improve, but their outlook improve.
I have never experienced 2 doctors that have more compassion and more drive to help their patients.
Erie's team is a cut above. I think that they are incredibly talented, and we've got great partners, and those partners are a huge part of what we do.
So we are a group of providers who care about our patients, and I think we would no matter where we were working, but we care about our community.
The whole notion of community health centers, and especially with Erie Family Health Center, is that we assess the needs of the community, and then we build our services based on the needs of the community.
Erie is access to medical care.
I grew up in a family where we didn't have health insurance. We went to the ER when we needed to, and we ended up with large bills. And to be able to come to a place that will care for patients regardless of that really speaks to me.
Erie is the only place you can take your children for care where you feel loved, respected, you feel like you can trust the doctors, you can rely on them to give you the best care you need.
We should be providing the best primary care possible, not just within the safety net, but the best primary care that anyone receives in Chicago, in Illinois, in the United States. That's really our daily vision.
It's an integrated healthcare model. And people come in and they get their height, their weight, their blood pressure. Well, shouldn't we find out, are they depressed, are they anxious? And I think of Erie as being kind of on the cutting edge of that.
It's a one-stop shop for all your health care.
Every pregnant mommy that we see in the health center, we are asking the question, when was the last time you've had your teeth cleaned? Because we know there could be a relationship between poor oral health and the health of the baby and the health of the mom.
Erie es mi familia.
We fell on hard times, and we needed health care. To find myself in this situation and then be surprised with what type of care we've received is priceless.
Erie is a health home that takes care of everyone, even my own family.
I would be lost if there wasn't Erie. I really don't know what I would do without Erie.
My dreams for Erie are that we really start to move up to even more complex care, including specialists, more services in patients' homes, really thinking outside the box once again, even though we have a big box already.
In fact, nowadays, we're thinking about what happens in between the doctor visit as being even more important than what happens at the doctor visit. And we're trying to meet our patients at that level too. And that's new.
It is. It's an exciting time to be at Erie.
Erie is a wonderful reason to go to work every day.
Erie is the only place that people care unconditionally.
It's just a place where everyone is welcome.
Erie is necessário.